Now it's my turn to introduce and start with our keynote speaker. She comes from Washington, D.C. I met her about, let's say, 3-4 years ago in the National Hispanic Medical Association annual conference, and I've been trying to bring her down for quite some time, and so we got lucky this year. Dr. Rios serves as president and Chief Executive Officer of the National Hispanic Medical Association. She represents Hispanic physicians in the United States. The mission of her organization is to improve the health of Hispanics. Dr. Rios serves as the president also of the National Hispanic Health Foundation, which is affiliated with the Robert Wagner Graduate School of Public Service in New York, in the New York University, and she also directs the educational and research activities there. Dr. Rios serves on the National Hispanic Leadership Agenda, Campaign Against Obesity, CARE First Blue Cross Blue Shield Boards of Directors, the Commission to End Health Disparities, and the GE Healthcare Access Advisory Board. She also previously served on the California Pacific Care United Healthcare California Investment Committee and the Partnerships for Prevention Board of Directors. Dr. Rios has lectured and published articles and has received several leadership awards, including the 2009 Top 100 Influential and Innovative Hispanics from Hispanic Business Magazine. Dr. Rios has been honored by the U.S. Department of Health and Human Services, Congressional Black, Hispanic, Asian, and Native American Caucuses, American Public Health Association Latino Caucus, the Association of Hispanic Health Executives, the Minority Health Month Incorporated Hispanic Magazine, Verizon's first Pollen Community Service Award, and AmeriMed. In 2006, Dr. Rios was appointed to the Minority Alumni Hall of Fame of Stanford University, and in 2008 was appointed as a fellow to the New York Academy of Medicine. So it is my honor and pleasure to introduce to you and bring Dr. Rios to the podium.
Yeah, we are an advocacy organization on the NHMA side. But let me first tell you why we do what we do. And I think the whole country and the world, as a matter of fact, is looking at costs and how do we save costs within the healthcare system. We know that it is the biggest driver of cost in our country in terms of the GDP and the trillions of dollars of debt that we have. We have to all look at how we can become more efficient and decrease costs. And for minority health or health equity, however you look at it, it means that we all have to figure out how to work together to advocate for being more efficient, but at the same time improving the health status of our communities. So the orange bar on the right is the United States. The other countries, the other developed countries of the world are all across this bar, and you can see that we spend more money on health care per capita in our country. But the key trends that are the context that we work by in Washington, D.C. as a National Hispanic Medical Association is that minorities face disparities in all kinds of rates, and this, for example, immunization rates, which is something very basic in prevention in our country. By 2042, over half of Americans will be minority populations. Latinos, especially, just since this is the focus of our organization, we have to think about how we are immigrants, we are mixed families, which means some of us in our families are not documented, some are. Just living in the same households, there's different issues, but at the same time we have very strong cultural values, and we will be 1 out of 4 Americans in the next 20 years or so. Our nation is undergoing a major transformation. I say this in a positive way. Cultural competence and language requirements now exist in hospitals, clinics, and even for medical education for the future providers in medical education and public health. Healthcare reform now expands healthcare coverage to Hispanics and African Americans, the populations in our country with the most uninsured, especially Hispanics, but also for African Americans. The most uninsured will now have access to coverage because of health reform. And this gives us an opportunity because it increases the need, a very strong need for education and outreach, and in this case also for research on how do we change behaviors in our communities to become more aware of the importance of healthy lifestyles. And quality and value payments for care that is patient-centered in medical homes is a new trend. Reimbursements are going to change for all hospitals and for all providers. That will be value-based. And what does that mean? We have to define what that means for our care of our patients. Disparities in obesity and chronic disease, and obesity especially because it was never recognized as a disease until very recently, and obesity being the forerunner for so many chronic diseases from arthritis to heart disease to diabetes. But disparities in these diseases for minority populations will remain high, and there will be a new demand for community-based health prevention and research. So the NHMA, our National Hispanic Medical Association, and our foundation, the National Hispanic Health Foundation, seek to cultivate public and private partnerships to make a positive impact, promoting prevention awareness and goodwill in new and growing Latino communities and markets around the nation. This is how we do our advocacy. So you also have to look at the context of the U.S. Department of Health and Human Services, and one of the most important strategies that just came out of this Obama administration was the National Prevention Strategy. Very new. First time to have a prevention strategy for the country, as we see the funding be redirected from a medical model to a prevention model, whether it's healthcare reform or medical education. These are the fundamental principles of the prevention strategy. To have healthy and safe community environments, create, sustain, and recognize communities that promote health and wellness through prevention, have clinical and community preventive services, ensure that prevention-focused healthcare and community prevention efforts are available, integrated, and mutually reinforcing. Empower people, support people in being able to make choices. Elimination of health disparities. Eliminate disparities, improving the quality of life for all Americans. And let me just make the point here that health disparities is no longer a minority issue. It is for all vulnerable populations or all special populations. Now we have rural Americans, disabled Americans. It's really been advanced. And immunizations, again, especially through states and with federal and state and local public health infrastructure. And I mention the immunizations only because CDC changed their laws in the last 2 years. Last year, for the first time in the flu season, all people in the United States above the age of 6 months are now required to have the flu shots. There's also a minority health plan, was introduced in 2011 by this Obama administration, and it's at 2 levels. It's at the whole department-wide minority plan and at the Office of Minority Health partnership level. The Affordable Care Act, just to make a mention of the Affordable Care Act, has put out a requirement, a mandate. It reauthorized the Office of Minority Health at the Office of the Secretary level, but at every one of the 8 major agencies at HHS, there is now an Office of Minority Health. At CDC, the Prevention Agency, at NIH, National Institutes of Health, the Research Agency, at the Agency for Healthcare Research and Quality, at the FDA, at the SAMHSA, the Substance Abuse and Mental Health Services Administration, HRSA, the Health Resources and Services Administration, which funds your centers of excellence and your faculty development programs. Every single agency now has a required Office of Minority Health. And at the NIH, we were able to advocate for that office to become an institute. It was an office, it was a center in 2000, and is now the very first National Institute of Health Disparities Research. So the principles are that we should have awareness of health disparities. And what HHS actually has told all of its agencies, that you need to look at all the programs and policies and resources that you have and redirect everything to take care of health disparities. There's a real need for more leadership to address health disparities at all levels, to have health system and experience on how you can eliminate health disparities, cultural competence and diversity of the workforce. That it's really about an understanding that we have very, very few minority populations within the workforce, whether it's physicians or nurses or public health, and we need to have cultural competence training or the ability to relate to minority populations at all levels and for all people in our workforce, and especially in our training programs because of that. Data, research, and evaluation is needed, of course. We need evidence-based to be able to change policies and programs. And we have to have a federal interagency team. That's brand new in terms of working together. Many of the programs under the Healthcare Reform Act, the prevention programs, the workforce programs, are bringing together different agencies that never worked together. The workforce, for example, is bringing together the Department of Education with HHS and the Department of Labor to come up with new ways of developing the healthcare workforce. And one example is the Promotora Initiative. Under the Office of Minority Health, there is a brand new steering committee made up of leaders of Promotora programs from all over the country. The Department of Labor initiated a new category within all the labor categories called the Community Health Worker. And in the Healthcare Reform Act, the health insurance exchanges are being given grants to provide jobs for community health workers who will be the ones to go out and educate our community families and individuals on how to select a new insurance program under the health insurance exchange programs. And the HHS Strategic Action Plan to Reduce Racial and Ethnic Disparities in Health is the formal name of the whole HHS plan. And the Tri-Caucus in the Congress, the Black Caucus, the Hispanic Caucus, Asian Caucus, those Tri-Caucus have a new health equity bill that we have supported. The First Lady is another example of leadership in our country, has put out her initiative called Let's Move. And this is, again, to really focus our efforts to decrease obesity, and especially childhood obesity. She is inspiring constituents and leaders. She's created a whole new foundation called the Healthier Generation Foundation. And some of the repercussions, some of the consequences, the whole beverage and food industry, for example, has created changes of their nutrition labeling. Walmart, one of the major employers in our country, has a new nutrition label. Also, they are all based on CDC evidence, low sodium, low calories, et cetera. So you see the movement following the First Lady's initiative. And I have to say the Surgeon General also was very involved with this. I have a quote from NHMA on the Hispanic fact sheet with the First Lady's initiative. And in 2012, we were asked to educate members and put out press releases to support the new Mi Plato or My Plate, the new food guidelines for the country. And this, again, is how we are utilized and how we get involved with advocacy. In terms of early childhood, I want to segue, because this is one of the initiatives that we have done. We had to look at the Institute of Medicine as the evidence base for recommendations for early childhood. This is from 0 to 8 years old. We're funded by the Kellogg Foundation, which is looking just at early childhood. And these are some of the recommendations. I'm not going to read all of them, but basically this is you know, evidence-based to change early childhood obesity. So doctors need to look at all growth. As you look at development, you also have to think about the risk of adult obesity and talk to your patients' parents about how you need to have more increased physical activity and eating, you know, dietary changes. Breastfeeding especially has been elevated as a recommendation, and increasing sleep of your children. There's also been a whole movement to voluntary national nutrition marketing standards. Of course, I was part of the hearing. I was at the hearing of the Congress who said, well, we don't really want to do this right now, and you know, it's going to be too costly to do this. A lot of reasons against it, but there was a major report to Congress that did happen in the last year. Providers are asked not only counseling patients, as I mentioned, but the First Lady is actually going to start a whole provider segment of the Let's Move campaign. And then social marketing, again, is one of the recommendations, and it started with Text for Babies at HRSA, which is an ability to send messages to mobile phones, which is a very big change in educating our patients. So our project, these are the components of a project that is really a policy advocacy project. We call it the Early Childhood Obesity Health Communications Project. And we put together a media advisory committee that's really focused on Hispanic media, starting with TV, Univision, and Telemundo. Then the publications, we work with the National Association of Hispanic Publications, which are all major magazines and newspapers in the country. We still have very strong ethnic media as a channel of communication to get to our patients. We also have the El Futuro Media Group. President is Maria Hinojosa, who's part of CNN and PBS. She runs a weekly Latino USA program on NPR, and some other groups that we're working with. We put together a Physician Leadership Institute to increase awareness of the actual Institute of Medicine evidence, all the federal agencies that are dealing with childhood obesity, like Head Start, the Department of Agriculture's school meal programs. Anyway, we brought together that information. We pulled together a group of doctors, Latino doctors from 2 states, California and New York. And we just decided we had to, because of budget, we had to limit who we were going to train. We also brought together state Latino caucus leaders from New York. It's Assemblyman Felix Ortiz, who's the chairman of the Latino caucus there. They call it the Puerto Rican Hispanic Caucus. And in California, it's Ricardo Lara, who's the assemblyman in charge of the Latino caucus. We brought people together to start developing education in February of this year. We also looked to a federal panel of experts, starting with the Surgeon General's office. The Surgeon General is now coordinating an effort across HHS and across agencies on early childhood and all childhood, actually, childhood obesity. But we did meet with her, and she's asked us to pull together information messages for PSAs that she will co-sponsor with us. The messages were being developed based on parent focus groups that we had in East Harlem and in Los Angeles. And again, the policy recommendations will be developed with email and portal community online between the doctor groups that we have. And this is no more than a dozen doctors who are developing. Their pediatricians and family practice, but we know that they have a lot of experience in working with parents of young children who are obese. The result of our recommendations will be brought to the Latino caucuses of the 2 states, in Sacramento, California, and in Albany, New York, in February and March of next year. We'll pull together the recommendations, put together a report, introduce it at our national conference in April. We are also working on media op-eds and press releases, and the whole idea is to empower and to have more obesity discussions, for example, at our national conferences and hopefully at others. So who are we? That was just an example of advocacy. We were established in 1994. NHMA is a 501c6 organization, which means we can do more advocacy than a 501c3. We represent 45,000 doctors. We now have a mission to empower Hispanic physicians to improve the health of Hispanic populations with our Hispanic medical societies, residents, and medical students, and public and private partners. And we believe in going above the politics and really focusing on the policies that improve the life of the Latinos in this country and other underserved. In 2002, we established our foundation, and we changed the name from the National Hispanic Medical Foundation to be broad-based and National Hispanic Health Foundation, a nonprofit 501c3 focused on research and educational activities. We are located at the New York Academy of Medicine and affiliated with NYU's Wagner Graduate School of Public Service. The board of directors, led by our chairwoman, Kathy Flores, out of UCSF and in Fresno, runs a Latino Research Center. As you can see, we have doctors from all over the country, but we also decided to change our bylaws. Only 51% doctors. so that we could incorporate some of the best minds who are looking at healthcare change in this country from the non-physician perspective. For example, we have Raymond Arroyo, Vice President from Aetna, who's looking at alternative distribution and development of activities as the insurance companies change to become patient-focused, behavior change-focused, education-focused. We have David Carlisle, who's a doctor, but he's the president of one of the historically black medical schools in this country, Drew University of Medicine and Science in Los Angeles. Jorge Girodi, who's from Chicago's Hispanic Centers of Excellence. We also have from the pharmaceutical world, Jorge Puente. He's a vice president. He's a Latino who actually happens to be the vice president for the Asia region, which is, again, a very important connection for us to learn about how we can get more involved. And the last three on the right are just to point out the fact that we have ex officio board members, one representing Dr. Lopez, representing all the Hispanic medical societies in the country. The second, Dr. Homan, representing our NHMA Council of Residents. And our third is a medical student representing, she is the national coordinator of the Latino Medical Student Association. For our foundation board of directors, we have we're under the leadership of Dr. Mark Diaz, who is a private physician with faculty status under UC Davis in California. And again, we have around the country, we have different representatives. Dr. Buford is the president of the New York Academy of Medicine, and we have also with us the Dolores Leon, who is our military. She was the first woman flight surgeon in the Korean War. A military connection. We would like to get more involved in veterans' health. Dewana Lewis is a vice president from Walmart on healthcare solutions. She's very interested in immunization and changing the emphasis to health within the Walmart stores. Gary Pelletier is a director of Pfizer Helpful Answers, which is one of the groups that provides low discount medications to patients. He happens to be the chairman of our corporate advisory board. Miguel Sanchez and Yasmin Winklers from United Healthcare, another insurance company. So what do? We serve as a resource for the White House, for Congress, and for federal agencies on health policies and programs. We also support physician leadership. We really believe that we have to have the expertise of all of you who are in the trenches, who are on faculty, who understand the community, whether you are Hispanic or not. You have the expertise and knowledge that needs to be connected to policymakers. And we provide networking opportunities for the advancement of Hispanic health at our conferences. These are how we do these things in terms of being a resource. We have Capitol Hill briefings at least once a year, sometimes twice a year, coordinated by Congresswoman Lucille Roybal Allard, who is the current chair of the Hispanic Task Force of the Congressional Hispanic Caucus. We recruit students to medicine for Office of Minority Health. We're just starting that, and for public health for the CDC. And we nominate our members to federal advisory commissions. And that's one of the major membership perks of our organization. So it is about serving as a resource to the federal government, and also as a resource to the private sector. We're getting more involved with how to get our members onto boards of directors of major companies in this country. And again, we do believe as the country is changing to understand that health is so important and is more fundamental, not going to the doctors and hospitals as you age and have your chronic diseases, but how about just understanding what healthy lifestyle is. We need to have doctors and nurses on corporate advisory boards so that they can change their programs, just like Walmart and, even Walt Disney just changed their programming for children. They're only going to advertise nutritious food or food that follows the CDC nutrition guidelines. Leadership development, we have our own leadership programs. Our biggest program is the NHMA Leadership Fellowship for mid-career doctors interested in learning more about leadership skills development. And we provide a whole week in Washington, D.C. to introduce doctors to everyone from the Surgeon General to the Secretary of HHS, and also foundations and think tanks and advocacy groups in Washington, D.C. We had a spirited conversation this September with the Senate Finance Committee, who wants to change the way doctors are reimbursed. We also had a White House briefing and invited about 150 people as part of our Leadership Fellowship Program to hear the updates on the Affordable Care Act. And in terms of networking, we have our national conference in Washington, D.C. in April, but we also have regional events. I just had one in Los Angeles last week, and then this week we have one in New York on what is the update of the Affordable Care Act in those states and regions. Our networks, very important when you advocate to have networks that can amplify and echo your messages. We have the regional medical societies, the state medical societies, and we have a new umbrella group that we call our National Hispanic Health Professionals Leadership Network, made up of national professionals, the National Association of Hispanic Nurses, the Hispanic Dental Association, the Latino Caucus of the American Public Health Association, the Latino Forum of Health Executives, and the Mental Health Associations, one of which is about to become national in Washington, D.C. for the first time, the Latino Medical Student Association, and then, of course, the schools of medicine that have signed on with us to become the recruiters in 3 states in the country, California, Texas, and Washington, D.C. area, because that's where our conference is. So it's University of Texas in San Antonio for Texas, Drew University in Los Angeles, and GW, George Washington University, that will be working with us at our conference. And our regional steering committees, we're about to go regional and have 5 regions in the country with steering committees who connect to our board of directors and, of course, our media advisory committee. Our partners include coalitions. Again, these are in Washington, D.C. and help us with advocacy. We sign on letters to other organizations through these coalitions. We also work with them in sending our staff to meetings that they are having with different Congress offices. The Racial Ethnic Disparities Coalition, the Commission to End Health Disparities is actually was started by the AMA and invited the NMA, the National Medical Association, and the National Hispanic Medical Association to work together. There's about 50 organizations that are all medical and nursing and some pharmaceutical who work with the Commission. And then the National Hispanic Leadership Agenda, those are all the 40 or so national Hispanic organizations, the LULAC, the National Council of La Raza, all the different groups. We're in charge of healthcare for the organization. The Campaign to End Obesity boards, in the federal level, the groups like the Institute of Medicine, we're asked to nominate doctors all the time to these different groups. And in foundations, of course, we're working with all the major foundations working on healthcare and obesity. Healthier Generation is President Clinton's foundation. Health Corps is Dr. Oz's foundation. And these are more partners from the federal government. And again, just an example of some of the partnership activities that we've been invited to be a part of. And again, it's not just me. We nominate our board members and our doctors. But the Office of Minority Health Hispanic Agenda, we were asked to be a part of the editing and the vision behind the partnership that I mentioned earlier in the presentation. The culturally and linguistically appropriate services standards for the country have just been revised. I have been on that national committee. The revision is going to be announced. The only new standard that was added was to change leadership in our institutions at the boards of trustees level to have more diversity within the boards of trustees. The CDC has an advisory committee to the director, and we sit on the subcommittee on health disparities, and of course we nominate our members. So for federal advocacy, just a couple last slides here. Lobbying is something that means that you have input to a specific bill or you actually change language. Much of what we do is advocacy, not lobbying, but we educate. We educate through our Capitol Hill briefings. We educate by having meetings with key chairmen of the health committees and the Senate and the Congress side, and also just working with our advocacy organizations about what is important to Hispanic faculty or to Hispanic recruitment of students, because many of the advocacy organizations are not connected to the healthcare system itself. We look at one or two bills a year, priority items as they arise. We've worked on healthcare reform, health professions workforce, Hispanic health research, cultural competency training, language services, prevention, disparities across the diseases, and of course the whole rise of the electronic medical record, health information technology. We've been asked to provide input to the Office of the National Coordinator, for example. These are just some of the specific bills that we were part of. The Healthy Hunger-Free Kids Act, I think I was the only Hispanic in the White House meetings with the First Lady's office trying to get more support for this bill. This was a very important bill because this year, 2 years later, this school year is the first time the school lunch programs and the school meal programs in this country have been changed to become more nutritious according to the dietary guidelines of the Department of Agriculture and HHS. In fact, all of the food programs, the food stamp program, which is now called SNAP, the WIC program for women, infant, and children, all the nutrition guidelines were changed based on that bill. And it almost didn't happen, but it did get passed. The Farm Bill reauthorization of this year, Healthy People 2020, the health disparities plans that I mentioned, the National Prevention Strategy, the Affordable Care Act health reform, and of course health professions recruitment of the underrepresented minorities. And I just mentioned that because this week the Supreme Court is going to listen to the Fisher case that came out of Texas, and we all believe that this is probably going to be the decrease to maybe even the demise of affirmative action in our country, and we're part of the amicus curiae briefs that were sent in by the AAMC to support affirmative action in this country. But the Supreme Court is going to hear it on Wednesday. The whole federal government with downsizing has has eliminated for the first time in our country the Health Careers Opportunity Program. Not only the HHS, HRSA agency, and that administrator, Dr. Wakefield, very strongly and passionate, believes in diversity, but not one program when other programs have recruitment efforts and diversity efforts. I went to the White House to complain and to talk about how to continue diversity recruitment in our country. They've now sent me to the Department of Education where the money is. It's all about the money. You have to follow the money. The HHS, unfortunately, because of healthcare reform, one negative, healthcare reform is going to sweep up all the funding, and programs that are not related to health reform will be stopped. So in our case, with health professions recruitment, the Department of Education with the STEM programs, science, math programs, will be probably the future for minority health recruitment. In terms of Congress and relationships, I work primarily with the caucuses and the health committees. On the Senate side, with the chairman of both the Republican and the Democratic side, Senator McConnell and Senator Reid. Senator Harkin's staff is in charge of the HELP committee, the health committee that handles the programs of health, but on the finance committee, they handle the financing program, so the Medicare and the Medicaid and the doctor reimbursement. The Democratic Senate caucus staff has their own meetings, and we work with them. And we also invite congressmen to our meetings, and we very much are very aware of being bipartisan and trying to avoid politics and becoming more focused again on our policy issues. We provide testimony to congressional hearings when asked, or at our briefings, and this is just kind of a step-by-step method that we use of introducing who you are, introducing NHMA. We set the stage, knowing the issue and the facts, what are priority options, and what are the recommendations that you want to put forward, and it's usually just 1 or 2 or 3 recommendations. And then after a specific bill is introduced or the hearing has ended, you really need to know what are the next steps, and always follow up with the staff. It's the staff who make the law move forward or the bill move forward. having specific action that they might request. For example, the Senate Finance Committee's asked me to pull together a committee of doctors for Hispanic doctors to know what are ways that they should be reimbursed in the new value-based reimbursement scheme of things as the SGR is being wiped out. So the next Congress will be focused on doctor reimbursement. Authorizing and appropriations committees for health, there's a different approach. Congresswoman Lucille Roybal Allard sits on the appropriations committee, which means they write the checks. They look at money. They don't look at the bill itself and the program itself. They can only talk about the programs that already have funding, and then they have to decide how much money or how little money. Understanding the history is very important, and recommendations that are realistic can bring about improvement outcomes. And of course, you always want to introduce others and bring others to the table, whether you're in a certain region of the country, or you're part of a faculty program, or you're part of a national organization. You want to introduce others to your issues. And we have a leadership fellowship program, and just to mention that we do advocacy through the program. Not only do we have lecturers who are key advocates and leaders, we have lecturers who are from the government. We also develop contacts and leverage discussion. We do our own policy papers through the fellowship program. We ask the doctors, and we have 10 doctors who are divided up into 2 committees who are focused on a certain policy issue. They present their papers at our conference. And you know, we believe that training members is key to developing a stronger advocacy organization. And again, doctors as advocates, or nurses, or public health leaders as advocates, you know, I really feel you need to meet your own congressman, your own senator. You need to understand the history of where they have been on your issues in the policy areas. You are a resource. You can contribute to their staff education. You can attend events. You can advise the congressman or his staff on issues with facts and strategies. You can invite them to speak at your medical school, get to know them that way, give them an award, develop the opportunities for them to be in the press. Policymakers love the press and need to show that they are doing things for their constituents. And then you can always send emails, faxes, calls, letters, and send in and be an active part of the policy process by just providing yourself as a resource. In our foundation, we're more involved with the education research. And again, our educational activity right now is our early childhood obesity program. Our research is really just to develop policy papers. We did a summit for the Josiah Macy Jr. Foundation. You can find the report on their website on how to increase diversity for Title VII. We brought together a group of 25 African American and Hispanic leaders from the Centers of Excellence and other medical schools around the country to develop that report. We're very interested in convening and developing policy research. We'd love to work with you. And we also have our own scholarship program for students interested in becoming leaders for Hispanic health. They don't have to be Hispanics, but we do have that scholarship program. And then here's our contact information, our 2 scholarship galas that we have right now. As we move into 5 regions of the country, we hope to have 5 scholarship galas, but right now we're in New York and Los Angeles. And our 17th annual conference is going to be the last weekend of April in Washington, D.C. So thank you very much.